This is One on One. We are pleased to be joined by Barry Ostrowsky, President and Chief Executive Officer of RWJBarnabas Health. Good to see you, Barry.
Good to see you. Thanks, Steve.
Let's go through this. RWJBarnabas Health, 11 hospitals, 32,000 employees, 9,000 physicians, 2 organizations come together. Very significant, right?
I think it's very significant. The most significant healthcare transaction in the history of New Jersey, to be honest with you. And one of the other metrics that I think is very important was we train 1,000 medical students, residents, and fellows every year. So we're very much in the academic medical space, as well as the service space for all of our patients and their families. We have incredible aspirational goals that we want to attain, and creating this new organization is going to allow us to do that.
As we get into the discussion, I want to make sure we disclose a couple things. One, that Barry is a board member at NJTV, and I've done a significant amount of leadership coaching and development at Barnabas.
That's what's made it so great.
Well, you went too far there. Let's talk about this. The merging of organizations, right? Big, yes. Significant organizations. Talk about the impact on patient care.
Well, we did this about patient care. One of the things we have to remember is neither of these organizations were desperate for a transaction. We were both very successful financially and, more importantly, very successful clinically. But we thought we could be even better. We could do more for our patients. We expand programs. We can expand our teaching footprint. Those goals are what this new organization enables us to attain. So if you're a patient in our organization at any venue, whether it's a community hospital or a teaching hospital, you now have the ability to plug into a deeper program, more collaboration among experts in those particular fields, and with new technology that we'll be able to introduce because of the resource base.
For example?
Well, now, of course, people are using teleradiography. They're using, in fact, video consultations. More importantly, we're able to get our professionals to confer with each other using technology. So if you have a series of specialists that are separated by an hour-and-a-half ride, we can put them on the screen. They can talk to one another. They can go over cases. And, in fact, they can teach using that, so everyone can tune in and have the benefit of a great expert in a particularly narrow field that, frankly, that student or resident may have lived without. All of this ultimately cascades to the benefit of the patient and their families.
Let's talk about some of the challenges, excuse me, Barry, that it creates in terms of communicating throughout a system this large with a footprint this large. How do you communicate with all those employees and 9,000 physicians as well?
Sure. It's a challenge. There's no doubt about it. First of all, the geography we cover includes 5 million people who live in New Jersey. That's more than half of the population of New Jersey. What you just put your finger on is one of the crucial initiatives that we have to satisfy. With 30+ thousand employees, we need to be perfectly transparent about why it is we did this transaction, how it's going to affect them. You know, when you do a transaction of this size, or probably any size, there's a level of anxiety among employees about their jobs, about their future, about what's going to happen to their institution. And so I personally am visiting every venue in which we have employees and patients, and I am explaining to the physicians, to the employees, to the trustees, all the background behind the transaction, what they can expect going forward. And of course, we have a robust communications department that has been peppering everybody with all the details about the transaction. I have to tell you, I'm about a quarter of the way through this tour, and the excitement is palpable. People, after we have the discussion, are excited. And of course, that's primarily because we're not laying people off, we're not closing institutions, we're not curtailing programs. This is all about a future state of healthcare for things that we need to accomplish, as opposed to having to correct anything that we've been doing up to date. And I think that builds enthusiasm, it builds confidence, and so our people are very happy. The physicians love the idea that we're going to be doing more research, which frankly is a very expensive commitment.
There's a Rutgers connection?
Yes.
Explain that real quick.
So Rutgers, of course, is a new owner of 2 medical schools after the UMD-NJ merger. And
University of Medicine
and Dentistry of New Jersey. Rutgers is very committed to expanding its research footprint. It already does some terrific research, but it needs to do more. We, as a partner with Rutgers, will be helping them fund and giving them the assets and resources they need to do more research. So NIH grants, which is the typical metric by which universities and organizations are evaluated as to their commitment to research, is something that we will be soliciting in much greater volume and for using the resources that we have. So we're going to be one of the reasons that research will expand in New Jersey.
Two other areas I want to make sure we cover. One is the diversity issue. You actually wrote a piece, I believe, for NJ Biz on the issue of women in leadership positions. But the other one is the wellness issue. You and I have talked on the air in previous programs, but also offline in a series of community forums. Wellness, prevention. Go ahead.
Well, everybody talks about wellness. It's a tough thing to define. See, I believe we're in the social service business. I've always believed that. Healthcare, conventional clinical care has been our major product line. You know well, so there are social determinants of healthcare. If you live under terrible circumstances residentially, if the streets aren't safe, if in fact there's not enough nutrition in your diet, if you're not doing exercise, these are the things that have to change. By the way, it's the right thing to do. It's a righteous objective for sure and mission, but we can't afford healthcare without that. People think that this is ancillary to delivering healthcare. It's not.
At the core?
Exactly, it's the core, because no matter how efficient we get in treating illness, unless you are able to have a certain percentage of people avert illness and take the resources that you would have spent on people who get sick who don't need to get sick, we won't have enough resources to treat people who do get sick. So we are committed to be in the neighborhoods, to be in the communities. These are the aspirational goals, frankly, Steve, that really drove this transaction. And by the way, the return on the investment will take generations. So, you know, when you buy an ultrasound machine, you see the results immediately. When you start developing better nutritional programs, when you start talking to people about better lifestyle, when you introduce behavioral health, you're not going to see that for a generation or two. We have to start, and we have to have the perseverance to continue. That's what this organization is going to do beyond anything that's been done before in New Jersey.
The other piece that I said I wanted to mention, by the way, there's a Devils partnership. Real quick, 20 seconds on Devils.
The Devils are New Jersey's only team as we see it. They are committed to community intervention, and we're their partners to do just that.
Executive women in New Jersey, Micheline Davis, a senior executive within the RWJBarnabas health system, taking a leadership position there. Women in leadership positions. You wrote a piece for NJ Biz that talked about this issue, a study that this organization that Micheline's connected to, Executive Women in New Jersey, put out a study. You responded to it. Talk about it.
Well, I'm very committed to, in fact, make sure that women are not limited by this glass ceiling that everyone talks about. They are underrepresented on boards of directors. They're underrepresented in the corner office. They're underrepresented on senior management teams. In our organization, 78% of our employees are women. And up until a few years ago, when Micheline spearheaded the initiative that we had, there really were no tracks to make sure that these women who are equally as committed, equally as smart, if not smarter, very good at their jobs, could get on a professional track to end up in the corner office. We have women running hospitals. We have women, frankly, on our senior management team in a great percentage. We're recruiting women for our boards. So I thought it was important to be able to talk to the rest of the business community and say, look, let's stop ignoring it or just paying lip service to this. Let's do something that is meaningful. And I have to tell you, the response I've gotten from my colleagues in management throughout the state has really been gratifying. I think there's the excuse that's used is you can't find a woman
to
put on. Well, it's absolutely untrue. First of all, you're looking for a woman who's already been on a board. Yes, there are few of that. How are you ever going to break into putting women on board? There are plenty of women who understand precisely the fiduciary responsibility of a board member, who understand what those obligations need to be. And by the way, it's good for business.
It's smart business.
It's very smart.
You're not doing
business.
A favor to women.
Exactly.
This isn't the PC thing to do. You say.
No. If you're going to run a business that's successful and half the population or more are women, why wouldn't you want women sitting on the highest level of governance in your enterprise? It's just counterintuitive to me. So everyone talks about big data and everyone talks about analytical information. Why not have the people who make many of the decisions? In healthcare, of course, women make most of the decisions. Why shouldn't they be at the board table helping your enterprise be more successful.
You expect this to change in the, you talked about long-term on the wellness before, you got a long-term ROI. You expect this to change?
This will change more quickly, partially because the workforce in all professional organizations now becomes more women, has become more women, and I don't think women are going to have the patience to wait for political correctness. They deserve it, and they need to be put there.
All right, last question. Barry was good enough to sit for another conversation we had on this book I've talked about before, Lessons in Leadership. And you've talked to me about your number one leadership lesson, but I need to spin it this way. You've talked about women in leadership. Mm-hmm. Do you believe, in any significant, meaningful way, most women in a leadership position would lead any differently than men? And if so, how?
I think they'd probably be better. I have to tell you something, one of the things I respect the most, we're not going to change necessarily the whole family organization. So we have women who are important executives who are able to balance their obligations at home, their obligations in family life, and still do terrific jobs as executives. Somehow, a gender-specific talent of being able to do all this balancing and get it right and ask the questions and understand it, I think we couldn't be a successful organization. I speak for ours. We couldn't be a successful organization without the women we have in incredibly important roles running big chunks of our company. It's a $5 billion company. We have plenty of room for talented and skilled executives, and the women we have and the new women that we'll be introducing into those roles will make us a better company.
By the way, go online, not just on our site, but go online to the NJBiz. There are media partners as well. NJBiz.com site, you'll see Barry's article on this topic. It's important reading. Barry Ostrowsky, President, Chief Executive Officer, RWJBarnabas Health. Thank you, Barry.
Thank you, Steve. Great to be here.
Stay with us. We'll be right back from the Tisch WNET studio here in the heart of Lincoln Center in New York City.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. This special edition of One-on-One with Steve Adubato is brought to you from the Tisch WNET studios at Lincoln Center. Funding has been provided by Bank of America, New Jersey City University, ADP, the Russell Berry Foundation, PSE&G, Qualcare Inc., and by New Jersey Sharing Network. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.